Now more than ever, Vermont's public health professionals have an essential role to play in our state for strengthening the health and well-being of all Vermonters. That includes preparing for future public health emergencies, working to advocate for the health priorities of our children and families, and planning resilient communities to withstand the effects of climate change. These are just some of the many dynamic roles that public health professionals play in our state. The Vermont Public Health Association is a membership-based organization whose purpose is to protect and promote personal, community, and environmental health within our state. Let's hear now from some of our members of the Vermont Public Health Association about the importance of investing in and strengthening the state's public health infrastructure and the role our association plays to advance the field.
As long as people have been organized into civilizations and groups, we've had a need for public health.
We bring in people who are physicians and nurses and social workers and nutritionists and epidemiologists and anthropologists. It's just such a wide variety, and we're all under the Big Ten of public health.
The reason that public health is more important than ever today is that public health challenges may be replaced by new public health challenges, but they don't go away altogether. And we need to do what we need to do collectively to address them.
And I think there's a lot of us in public health who were, worked in clinics and in hospitals, physicians, nurses, nutritionists, and it gets a little frustrating because you don't want to see those people come into the hospital in the first place. We can stop this with basic community programs to help with healthy living, with injury prevention programs, with developing good medical systems so people can access preventative care, and then you can move up into management and overall systems like state systems and national systems.
I found that a lot of the issues that I really was passionate about at the core really had to deal with social determinants of health, health disparities, addressing it on a larger level than just the individual level.
Really, when you make that shift from thinking about doing clinical interventions sort of at that individual level to more of a systems-based approach, I think that right there is where you make the shift into public health.
It's a bit dramatic to say it this way, but I think our lives depend on it. It touches all areas of our society, and I hope we've learned as a community, as a state, as a country, how important it was to follow the science and to listen to our leaders who are deeply involved in the science as we try to make policy decisions about our own lives.
So our members represent a broad cross-section of sectors and public health interests throughout the state, and there are so many benefits of becoming a member of the Vermont Public Health Association, including building and deepening connections with like-minded professionals across the state, participating in trainings and professional development opportunities such as joining one of our committees, advocacy opportunities to advance important policy changes in our state, and additionally joining annual convenings.
The Vermont Public Health Association is important to advancing health in Vermont because public health, it exists across a lot of sectors in Vermont, and there's a lot of different organizations, a lot of different entities that are engaged in public health. But the Public Health Association can just continue to be this independent voice for public health. It's not under any kind of political pressures.
We've always been concerned about health equity. That's just part of social justice. And that's really what public health is all about.
We educate, we communicate, we advocate. So we educate the public and others, partners, about some of the current public health challenges that we have in Vermont. And so we work on public health policy positions in a way which is intended to share the information that we gather with legislators and other public health policymakers.
The Vermont Public Health Association is in a real growing space right now. There's a lot of room across different disciplines for folks to work together. And I think when you lead through science and lead through knowledge, you can have a certain neutrality about the way you convene organizations.
Being able to intern with the association allowed me to ultimately take a leadership position here on my UVM campus and engage in public health outreach here on campus and getting more people involved in career opportunities, internship opportunities.
So the Vermont Public Health Association is definitely invested and committed to helping to prepare young people who are interested in entering the public health workforce. We're engaged in giving people opportunities for actual practicing public health. Students are helping us with programming, helping us to do communications work, helping us to write policy statements. But we're also helping to sort of inform people about what public health is.
I think not only did the opportunity allow me to work with my peers in a way that I hadn't before in a professional sense, but it also allowed me to develop presentation skills. I got to present at the annual conference, which was very exciting and an opportunity that I definitely wouldn't have had before. And it sat me in rooms with people that had had lifelong careers in public health. It showed me that you don't have to be limited to just one single career path, that there really are so many different opportunities to get involved in public health at the state level, at the local level, nationally, and that there are so many people doing very interesting and necessary things here in our state.
Whether you're first starting out or whether you've been doing this work for a long time, I think it's an important best practice to continue to seek out networks that increase your collaboration, increase your inventory of finding solutions. Public health requires many different people at the table, many different diverse solutions and creative, innovative ideas. So tapping into networks like the Vermont Public Health Association is a great start for anyone who's beginning, and also a great layer who's been, for any organizations who've been doing this for a long time.
That's what's so great about the Public Health Association, because no matter where you are in your career or moving laterally or up and down, or even after you retire, we have the Vermont Public Health Association. We're the constant, always, as for young professionals, for students. I'm recently retired, and I wasn't upset about retiring because I knew I had the Public Health Association to continue being involved and staying involved in public health.
There are a lot of benefits to being a member and being associated with the Public Health Association. It gives me a professional community. I first got involved with the Public Health Association through attending one of their annual meetings. What I really did at that meeting was I made connections to people that work in the public health community that I didn't really know. And it gave me this sort of professional home that I've been looking for since I moved to Vermont.
We're a membership organization, and we hope a lot of folks will join. There's a lot of room for everyone to participate. The Vermont Public Health Association has an opportunity to convene thinkers in different areas and help different disciplines learn from one another.
Increasing your network, increasing your partnerships, increasing your support. Collaboration is key to creating lasting change, and Vermont Public Health Association is a great network of professionals who care.
I can't imagine anyone who doesn't get excited about public health. It brings in so many different disciplines, and everyone is together, working together for social justice, health equity, and the overall public's health. Being able to be involved in the Public Health Association makes me feel like I'm doing something.
So we hope you'll consider joining us and contributing your unique perspectives, experience, and voice. And together we can strengthen public health within our great state.